Hey folks, this is Dr. Mike. I'm back here again, and probably you're asking, Dr. Mike, you got on the same shirt. Well, folks, we're shooting a batch of these on one day, so I don't wear the same shirt every day. Now, I'm joking, but I know some people are like, hey, he's got on the same shirt. Well, we're doing a batch of these, and we're now at number 25. Now, number 24 talk to physical therapists. Number 25 is going to talk to physical therapists also. As a physical therapist, whom should I hire to run my MET program? Now, folks, these tips come from the 101 most common questions we've received over the last 30 years running the Medical Exercise Training Institute. Our programs, our medical exercise specialists, our post-rehab conditioning specialists are never designed to take the place of physical therapy, chiropractic care, nor any medical services at all, but to augment those when these individual patients are discharged and you refer them to fitness professionals, they now become their clients. The fitness professional is not performing any therapy, any treatment. They're working with clients and not patients. But we all know there needs to be ongoing exercise because it is the most important component of the rehab aspect. So before I get into this one, please make sure you go over to MET101ebook.com. And forgive me, this is tip number 25. I didn't advance the slide, so accept my apologies for that. But if you would please listen to tip number 25. Again, as a physical therapist, whom should I hire to run my MET program? The best candidate to run your aftercare program is one of your rehab technicians with at least 1 year experience working in your facility. In addition, I recommend completion of our Medical Exercise Specialist Training Series program. The MEST programs provides more clinical anatomy and pathology than your staff members will receive in your employment. Because let's be honest, as a staff member in a physical therapy clinic, if you're a support staff member, you're getting OJT, on-the-job training that may not go in depth into clinical anatomy and pathology. Our staff members are picking up whatever the therapists are giving them with regard to on-the-job training. Now, with that, now don't just take that as a criticism. It's not. It's the way it is. I've been there. In a busy physical therapy clinic as the owner, you don't have time to thoroughly explain anatomy and pathology to your rehab techs. But our MEST program does provide that level of instruction along with use of MET protocols and program administration. Remember, the clients in your MET program or aftercare program have been discharged from physical therapy. Let the MET staff members manage these clients. They're not patients anymore. They're clients. And you have enough to do managing your PT clinic, managing the insurance gauntlet out there, and dealing with referrals from physicians and therapists and everything else. Get yourself a good rehab technician, the best one you have. Our prototype was a young lady named Angelica. She had been a rehab tech with us for about a year. She was in charge of the exercise program. She had a background in exercise physiology. She did not have a degree. She had a background as an EMT. She also had some background as an athletic trainer, but she did not have an athletic trainer certification. She was ideal in that she could work with the patients on the rehab side. And then when we discharged them, she had enough understanding that she could transition the patient over to the post-rehab or aftercare program seamlessly. We would meet periodically, usually once a week, to talk about the clients to make sure they were progressing well. I just simply would greet the client, hey, how you doing? I wanted to make sure they understood there was no physical therapy involved. And we made it clear to, if their insurance carrier was reimbursing or some other entity was reimbursing, it wasn't physical therapy. It was an aftercare program run by our technicians, and it was just simply a supervised-based, structured, protocol-based also, exercise program. So find yourself a good rehab tech. You may have to invest a little bit more in getting them properly trained. I think our MEST program is the best one for that, but the need is there. It's going to continue to grow. Most importantly, it allows you to better control the client's outcome as a physical therapist or a chiropractor. So all the best. Make sure you get your copy of the MET 101 ebook, and thank you for watching. We'll see you next time. Take care.